The American people have voted away their freedoms in exchange for the promise of free medical. It only took 2 generations from what is commonly called the greatest generation. Good evening, ladies and gentlemen. The purpose of the presentation you are about to see tonight is to give you the big picture on government-controlled medicine. We're going to define it, tell you who's going to finance it and how it will affect the average American citizen, who is in control, how did it happen, is there a hidden agenda, and some workable solutions. Healthcare as dictated by the government. Now, normally before you discuss the subject, the first thing you do is define it. This is Public Law 111148, which gives the government complete control over your health care. This is a 4-inch binder filled front to back with pages printed on both sides in number 10 font. It takes 2 hands to hold this up. How do you define this? To give you a comparison, these are our founding documents: the Declaration of Independence and the Constitution of the United States. And as you can see, I can hold these up with 2 fingers. The Declaration of Independence defines human rights. We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights. Among these are life, liberty, and the pursuit of happiness. The Constitution gives us a roadmap to guarantee these rights. We the people, with emphasis on we the people. Just what is government-controlled health care? A bureaucratic's definition would look something like this. And as you can see, the Secretary of HHS is directly in the center. I will attempt to define the undefinable. Public Law 111148 has 10 titles, 58 subtitles, and 456 sections. And I have not even begun to count the subsections. Fact. On June 28, 2012, the Supreme Court found government-controlled health care constitutional. They reaffirmed that decision on June 25, 2015. And here are over 200 pages of their ruling. But fortunately, in this country, we have political cartoonists who can say with one picture what it took the Supreme Court over 200 pages. Please pay careful attention to the poster in the window. Buy a new Chevy Volt or pay a $2,000 tax. This, ladies and gentlemen, is the law of the land. For the very first time, the federal government can force you to buy something, and if you do not, they can punitively tax you. This forever alters the relationship between the federal government and its citizens. But someone far more eloquent than I put it this way: Obamacare has done, thanks to Chief Justice Roberts' Supreme Court decision, is reduce us all from free citizens to cowed subjects, whom the federal government can order around in our own personal lives in defiance of the 10th Amendment. All the other protections of our freedom in the Constitution of the United States. Thomas Sowell. Question: how is government-controlled health care going to be paid for? Title IX contains 17 revenue physicians. 17. That will raise over $1 trillion in tax increases. $1 trillion. Ask yourself this question. Where's the money? When Willie Sutton was finally arrested by the FBI, they asked him, why do you rob banks? And he said, because that's where the money is. So where is the money to pay for government-controlled medical? Let's say we have 500,000 millionaires and billionaires in this country. I don't think we do, but let's say we do. At the last count, I believe there was 416 billionaires in the United States. And let's raise their taxes $100,000 apiece. That will raise $50 billion. Now that's a lot of money to you and me, but it wouldn't run the government 1 week. Now, let's say we have 100 million middle class. That makes sense. There's 315 million citizens in this country, 100 million middle class. And let's raise their taxes $10,000 each. That will raise $1 trillion. Ladies and gentlemen, the money to pay for government-controlled health care is in the middle class, not the wealthy. Let's talk about just 3 tax increases. And remember, there's 17 revenue provisions. Capital gains tax was 15%, is now 20%. That's an increase of 33.3%. Medicare tax was 2.9%. It's increased by 0.9% for singles making over $200,000 a year and couples making over $250,000 a year. That's an increase of 31%. For the first time, the Medicare tax applies to investment income, interest, dividends, and capital gains, 3.8%. And this, ladies and gentlemen, is where they get the middle class. Important point. Yes, you will pay the 3.8% Medicare tax on capital gains realized from the sale of your home, in addition to the 20% capital gains tax, in addition to the 11.3% state income tax. Because remember, when you have that one-time capital gains from the sale of your home, you go way up in tax brackets. Let's take an example. Widow sells her house that she and her husband purchased 30 years ago. She wants to move to be near her children and her grandchildren. Capital gains on this home is $550,000, which makes excellent sense on a house that was bought 30 years ago, especially in California. You have a one-time exemption of $250,000. The taxable capital gains, therefore, is $300,000. Medicare tax, 3.8%, $11,400. Capital gains tax, 20%, $60,000. State income tax, 11.3%, $33,900. That's a grand total of $105,300. You would think that was enough, right? Think again. Because Part B of Medicare is means tested, for the next year, the widow will pay an additional $149 per month for Part B. That is an additional $1,788 for that year, making the grand total $107,088. Can the average widow afford these taxes? Section 9013, modification of itemized deductions for medical expenses. In 2013, the floor of allowable medical deductions increased from 7.5% to 10%. For example, family adjusted gross income, $78,150. Now, I chose this figure, ladies and gentlemen, because according to the Census Bureau, that is the median income for a family of 4 in California. In 2012, this family had to pay $5,861 on medical expenses before they could deduct 1 penny. In 2013, this same family is going to have to spend $7,815 on medical expenses before they can deduct 1 penny. That's an increase of 33.3%. 3 tax increases, ladies and gentlemen, just 3. Capital gains, up 33.3%. Medicare tax, up 31%. Medical deductions, up 33.3%. And no one can argue that these are not significant tax increases on the middle class. Remember, all taxes are paid with discretionary income. That's the money left over after you pay your mortgage and food and clothes and education. When your taxes go up, your mortgage does not come down. Maybe we should call this the Unaffordable Care Act. None of this will affect me. I hear this all the time. Tom, I won't even make $50,000 this year. None of this will affect me. Yes, it will. It will affect every man, woman, and child in this country. For example, Section 1341, effective January 1st, 2014, every employer must pay a $63 tax on each employee covered by medical. That will raise a slush fund of $23 billion. Now, ladies and gentlemen, anybody that's ever been involved in the budgeting process of business knows that every year the company takes X number of dollars and they put it in the budget for employee compensation. Out of that budget comes the cost of medical insurance. The $23 billion will come out of the budget for employees' compensation. In other words, $23 billion goes to the government instead of the employee. Premium and deductible increases. According to the Kaiser Family Foundation and the Health Research and Educational Trust, 2015, the average annual cost of family coverage was $17,545 per year. That's $1,462 per month. In many cases, the deductible is $6,000 per year or more. The smoke and mirrors here is, on a lot of these policies, the deductible is only $500, but you have a co-insurance of $5,500. The net effect is the same. You must spend $6,000 on medical before your insurance pays a penny. This is so the government can say deductibles haven't gone up. If that's not enough, now California wants to tax our health care plans to pay for Medi-Cal. Subtitle F, Shared Responsibility for Health Care. This is the tax or fine portion. Section 1501, requirement to maintain minimum essential coverage. This is where you must have the coverage that the government says you must. Individual mandate excise tax starting January 2014. Well, it's 2016, so let's look at it this way. Family income, $78,150 per year. Maximum tax is 2.5% of adjusted gross income, or $1,390, whichever is higher. The tax would be $1,954 per year. Average premium is $17,545 per year. Savings by paying the tax and not purchasing health insurance is $15,591, or 88.9%. Ladies and gentlemen, the incentive is to not buy health insurance. No! Employer's tax effective 2014. Well, again, it's 2016. Business owners with more than 50 employees must buy government acceptable health care coverage. And the operative words are in red. 50 must government acceptable. Or pay a yearly tax of $2,000 per employee of at least one employee receives a tax credit. The math is unbelievable. If just one employee receives a tax credit, the employer has to pay $2,000 per employee, not counting the first 30 employees. An employee with a family of 4 can earn up to $94,200 per year and get a tax credit. $94,200 per year. That means that 62% of the American people will get a tax credit. Almost all employers will have an employee receiving a tax credit. Magic number of employees. Guess what the magic number of employees is? 49. Because the minute you hire that 50th employee, all of this comes into play. They are calling these companies the 49ers. The news is full of stories about companies that are reducing working hours to less than 30 hours per week. Some employers will drop coverage altogether in response to new regulations and the availability of subsidized insurance in the new exchanges. How many is anyone's guess? But it's already happening, ladies and gentlemen. IBM retirees on the exchanges. AT&T retirees on the exchanges. Target no longer purchases health care for part-time employees. Almost every employee of fast food restaurants is working less than 30 hours a week in order to avoid the Obamacare taxes. From the headlines, many face new normal. Part-time pay, full-time bills. Do you still want to say none of this will affect me? January 1st, 2014, no pre-existing conditions. And this, ladies and gentlemen, is the linchpin of the whole thing. Let's do a little more math. Employer's cost of health care. 50 employees, first 30 exempt. The tax is going to be $40,000 per year. But the cost of premiums is going to be $877,250 per year. Savings by paying the tax and not providing health insurance, $837,250 a year, or 95.4%. What do you think companies are going to do? Simple math. It is cheaper to pay the tax, and then if you get sick, go out and buy an insurance policy. Ladies and gentlemen, for all practical purposes, you can fill out the application for medical insurance in the ambulance on the way to the emergency room. No pre-existing conditions. And when you get better, you simply drop the policy and do it all over again. No insurance system can survive under these circumstances. I want to shift gears here a little bit, ladies and gentlemen, and move away from the taxes and talk about who is in control. That's kind of an important question. Fact, Section 6301 establishes a patient-centered outcome research institute. Establishment. There is authorized to be established a nonprofit corporation to be known as the Patient-Centered Outcomes Research Institute, which is neither an agency nor establishment of the United States government. Let me read that again. Which is neither an agency nor establishment of the United States government. And that comes word for word right out of the law. Section 3403 creates an independent Medicare advisory board. The job of this board is to control the cost of Medicare. In general, the board shall develop detailed and specific proposals related to the Medicare program in accordance with succeeding provisions of this section. Now, ladies and gentlemen, this section goes on for approximately 6 paragraphs, and it contains a whole lot of legal language. But the most important sentence is the last sentence, and that's the one of most concern. Any advisory report submitted under this subparagraph shall not be subject to the rules for congressional consideration under subsection D. Question: who is going to hold these boards accountable? Does this mean no oversight by our elected officials? Quote from the official Democratic Party talking points on government-controlled health care. And I have them right here, ladies and gentlemen. And the cover letter is signed by Nancy Pelosi.
Find out what is in it.
Question: I have heard that under health care law, there is a panel that can order my doctor not to give me a certain procedure, therapy, or care. Bureaucrats will decide whether I live or die. The official answer: there is no such panel. This is a blatant falsehood. Section 6301, Patient-Centered Outcome Research Institute. Section 3403, Independent Payment Advisory Board. Now, these boards have interesting names, but they lack the panache of the English system, which is nice. National Institute for Health, clinical excellence. But make no mistake, ladies and gentlemen, these three boards have the exact same job: to determine quality adjusted value of life. I will leave it up to you, ladies and gentlemen, to decide whether the official Democrat answer is true or false. But a lot of this looks like a lot of our future is just like that. Section after section of Public Law 111148 contains the wording, "the Secretary shall." According to the Wall Street Journal, this phrase appears 1,563 times. Who is actually writing the healthcare laws? Now, at this point in the presentation, we used to say Kathleen Sebelius. But my question always was, is it Kathleen Sebelius or is it a czar in the White House who reports only to President Obama? Meet the healthcare czar, Mr. Gruber, who thinks Americans are too stupid for the truth. He is the one that wrote the healthcare law. Did you ever see his name on a ballot? Did you see him in front of the Senate being confirmed by the Senate? And the only reason we know about Gruber is he was too stupid to keep his mouth shut. The Department of Health and Human Services submitted a final rule-making on the state of health insurance exchanges that created yet another accounting shell game, one that could force private citizens to pay for coverage of elective abortions. We got time out here. A lot of people are saying, wait a minute, we have a U.S. Constitution.
We the people.
And Amendment 1 clearly states, Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof. And there are many, many people in this country, ladies and gentlemen, who hold strong religious beliefs against abortion. And they feel being forced to pay for abortion with their tax dollars is prohibiting the free exercise thereof. To compel a man to furnish funds for the propagation of ideas he disbelieves or abhors is sinful and tyrannical. Thomas Jefferson, one of our founding fathers. Centralized computer records. Government-controlled healthcare gives the government everyone's medical records. Your medical records will not be private. The language is not in the law, but in the Federal Register, which has the power of law. The authority comes from HIPAA, which allows release of patient records without consent for other agencies for other activities necessary for the oversight of the healthcare system. Healthcare as dictated by the government also directs the IRS to share confidential personal tax returns with the exchanges and other government agencies. Think about that, ladies and gentlemen. The two things that most Americans consider their personal business and nobody else's is the state of their physical health and the state of their financial health. Yet both of these records will be mixed in a database in Washington, D.C. for any government clerk to look at any time they want to for other reasons. And I have not even mentioned hackers or leakers. You have no reasonable expectation of privacy regarding any communication of any data transmitted or stored on this information system. Ladies and gentlemen, that is off the official healthcare website, but you won't find it on the home page. You have to go to the source code to find it, but it's there. Question: is there a chain of accountability? If so, who is accountable? The Internal Revenue Service? We all know how the Internal Revenue Service is accountable to the average American. Just ask Lois Lerner. It is the IRS who will make sure that all taxes are paid and who will also determine who is eligible for taxpayer finance subsidies. Anytime anyone's situation changes, a raise, a new job, a move to another state, that person will be required to report it to the IRS for purposes of recalculating their eligibility. Required to report it to the IRS. Love political cartoonists. No, I'm from the IRS. Your health insurance papers, please. George Orwell's 1984. Has fiction become reality? But no one has put this better than Ben Stein. Fathom the hypocrisy of a government that requires every citizen to prove they are insured, but not everyone must prove they are a citizen. And now, any of those who refuse or are unable to prove they are citizens will receive free insurance paid for by those who forced to buy insurance because they are citizens. Question: how did this happen? The law was passed by one political party, Democrats only. Not one single Republican voted for it, not even Olympia Snowe. Those who voted for it did not read it. Think about that. A law that affects every man, woman, and child in this country was passed by our elected representatives, and they didn't even bother to read it. They passed it on sound bites. There was open bribery of elected officials. Again, our elected officials were bribing other elected officials with taxpayer dollars on television. Can you imagine what went on behind closed doors? Promises made. If you like your coverage, you can keep your coverage, period. If you like your doctor, you can keep your doctor, period. Unfortunate truth. President Obama lied, period.
That sometimes government has to step in to help deliver on that promise.
My health care law is not a tax. I'd like a second opinion. It's a tax, but that really should be Chief Justice Roberts in the second panel.
But if the Constitution says that the big guy should win, well, then the big guy's going to win.
Question: is government-controlled medical care delivery system workable? Let's take a look at how well the exchanges are working. In 2014, health insurance enrollment was 9.25 million. But 8.99 million of those people were forced onto Medicaid. And I use the word forced accurately, because you go on the exchanges, you put in your income. If it's below a certain amount, you're on Medicaid. That's it. You don't have any choice. You're on Medicaid. In 2015, 11.69 million people enrolled during the enrollment period. At the end of the year, there was only 8.78 million on the exchanges. 25% either never paid or dropped the insurance. If you look at the map of the United States, all those states in red are states where there is less insurance available on the exchanges. An important point. Health insurance is not medical care. If you're insured by Medicare and you're looking for a new doctor, I wish you the best of luck. If you're insured by Medi-Cal or Medicaid and you're looking for a new doctor or a new hospital for that matter, I wish you Godspeed. And for those of you who are really in love with Medicare, remember your insurance company, Medicare, and everybody else has become your primary care physician. They are the ones that are calling the shots as to what medical care you get or don't get and when you get it. Question: isn't it time we listen to what the doctors are saying? After all, doctors are essential to health care. I would like to introduce Dr. Patrick Wagner, a practicing surgeon for over 30 years. His insight into the present medical system should prove invaluable.
Good evening, and thank you, Tom, for the opportunity to speak up about my experience in medicine and surgery and to explain how I and many other doctors feel about our present medical system. To experience the destruction of a very, very intimate and loving friendship, that between myself and my patients, is heartbreaking beyond description. That same heartbreak is manifest in the loss of my friends, the doctors and nurses who I called on and who called on me to heal you. That same heartbreak is felt for the youngsters aspiring to be doctors and nurses who are not being adequately prepared to practice medicine and enjoy an extraordinary and enchanting career in medicine. That heartbreak is for you, my fellow Americans, who go to the doctor now and find a system that doesn't make you feel good. I'm sorely saddened by that most of all, because inherent in that scenario is undue suffering and avoidable death because of the greed and malicious negligence of those now in control of medicine. I'm still a licensed physician, but not practicing at this time. And I stopped practicing because of the constraints under the present healthcare system.
Thank you, Dr. Pat, for that insight. How many doctors will do the same as Dr. Pat? Or simply refuse to participate in the exchanges? Over 214,000 doctors opt out of Obamacare exchanges. That's nationally, 214,000 doctors. Will the young be motivated to enter the medical field? We want our best and our brightest in medicine. But our best and brightest will look at risk, reward, and make their own decisions. The doctor's office as a union shop. A new healthcare laws turn physicians into service workers. Why wouldn't they organize? You have nurses' strikes all the time. Covered California, the gold standard for state exchanges. Cedars-Sinai Hospital is the best hospital on the West Coast for cancer patients. Cedars-Sinai Hospital is not participating in the exchange. This is what California looks like spread out by region on Covered California. And if you look at the top of the state, there's 23 counties. Of those 23 counties, there's only 3 choices of medical insurance, and that's not in every county. Some counties only have 1. That's the budget for Covered California for the 2015-16 year. We are going to spend $332.9 million on the Covered California exchange. That's what the taxpayers are going to pay. And $121 million of that is to sell the program. If the program is so great, why do we need all that money to sell it? Used to be, you picked up the phone, you called the insurance company, and you got your insurance. Now we're paying almost $333 million for the same privilege. The interesting thing about this chart in this budget is that I got this off the Covered California website, but when I went back to research it, it was down. But I had already downloaded it, and I've got the budget right here. From the headlines, 7 in 10 doctors boycotting California's exchanges. Consider the big picture. In the United States, no one is denied health care. The quality is not the problem. But as we get further and further into Obamacare, I'm getting more and more argument on that particular statement. The problem is the cost. So why government-controlled medical? Does government-controlled medical really address the problems of cost? According to the supporters, government-controlled health care was supposed to solve 2 problems. 1, insure 30 million uninsured Americans. 2, make health care affordable for all Americans. Thus the title Affordable Care Act. Supporters of the law are quick to point out government-controlled health care has accomplished 2 things. Number 1, children can stay on their parents' health plan until age 26. I really don't see the advantage to that because when my kids were in their 20s, they could buy health insurance a lot cheaper than I could pay for it on my company plan. Number 2, no pre-existing conditions. Yet almost every health plan had a guaranteed renewable clause. So no pre-existing conditions was not a problem. In reality, to date, government-controlled healthcare has accomplished two things. One, basically destroyed the health insurance industry. I have talked to many health insurance brokers who say by 2017 they're going to need a new profession. Two, completely altered the medical care delivery system in such a way as to greatly limit the patient's choice. Americans have arrived at the point where medical services can be delivered in one of two different ways. We're there, ladies and gentlemen. It's going to go one way or the other. The left's default position, healthcare dictated by the government. The system goes by many different names: single payer, socialized medicine, universal healthcare, but they all mean the same thing: healthcare dictated by the government. 100%. That's an interesting figure, 100%. All of the experts I've talked to in the medical field, doctors, nurses, lawyers, hospital administrators, Medicare administrators, all tell me the same thing, that if Obamacare is fully implemented, 100% of them say that single-payer system will be the result. And when do you get 100% of anybody to agree on anything? Question: is Obamacare purposely designed to fail so the American people will be so mad that they're willing to accept universal coverage? Can private insurance still exist when the Department of Health and Human Services is telling them what to put in their policies and what to charge for their policies? They've already been told they must cover certain women's health issue, contraception, morning after pill, at absolutely no cost to the patient. When yearly deductibles are $6,000 per year and higher. Can you take $716 billion out of Medicare without serious consequences? You can't take $716 billion out of any program without serious consequences. Medicare Advantage, very popular among senior citizens. Kaiser Senior Advantage, for example. Medicare Advantage will be phased out over a short period of time. For all practical purposes, Medicare Advantage is gone. You can still have Kaiser Senior Advantage, but just pay a whole lot more for it. Obamacare's oligopoly wave. Oligopoly basically means no competition. Bigger insurance, bigger medicine, and health consolidation frenzy. If the logic of Obamacare prevails, this exercise will conclude with all 5 major medical insurance companies fusing into one monster conglomerate. In other words, a cartel. Companies form new alliance to target health care cost. 20 major employees band together in a bid to hold down the cost of providing workers with benefits. Think about that. 20 major companies in the United States are going to get together and they're going to offer their workers one choice of medical coverage. Well, wait a minute. One can't be a choice. You're going to have to take what they give you. Today, Medicare and Medicaid together cover about 1 in 3 Americans. Just what is health care dictated by the government? Just exactly what is it? Well, here's a lighthearted look at it. You can see where the doctor has a stethoscope. But there's an article by Jeffrey Singer. It's a 1-page article, and it describes what universal health care is better than anything I've seen. And I want to read you the middle paragraph. In other words, we're about to experience the 2-tiered system that already exists in most parts of the world that provide universal coverage. Those who have the financial means will still be able to get prompt, courteous, personalized, state-of-the-art health care from providers who consider themselves professionals. But the majority can expect long lines, mediocre and impersonal care from shift-working providers, subtle but definite rationing, and slowly deteriorating outcomes. This is something, ladies and gentlemen, I would never like to see happen in this country. But unfortunately, it's already started. As reported by the Association of American Physicians and Surgeons, death, the only treatment option. Death, the only treatment option? Quebec, palliative care clinic to be killing center. Palliative care is what we call hospice. When a palliative care center in Quebec announced it would not offer euthanasia, the Minister of Health ominously told them, yes, you will. In the United Kingdom, patients are pushed to choose suicide over abandonment or unreasoned pain. What that means, ladies and gentlemen, is if you have cancer and you have 6 to 8 months to live, you can either commit suicide or go home and die in unreasoned pain because they will not give you any treatment or any pain pills. Some choice. That can't possibly happen here. How can that possibly happen here? Governor Jerry Brown signed ABX 2-15, California End-of-Life Option Acts, into law on October 5th, 2015. For those of you who doubt liberals and the progressive have been mobilizing to make single payer a reality, the Vermont House announced its intention to regulate the private practice of medicine in Vermont out of existence. Colorado Care. The Secretary of State office announced that a single payer proposal will appear on the 2016 ballot. A lot of red tape, ladies and gentlemen, a lot of red tape. The other way, the American people taking personal responsibility for their own health care. Eliminate third-party payers. Again, almost every expert I talk to say if you want quality medical care at a reasonable price, you have to eliminate the third-party payers. Get the government out of it. Get your company out of it. It's between you, your doctor, and your insurance company. And the doctor and insurance company have got to understand that you are the patient, you are in charge. Private practice of medicine are what we're talking about, ladies and gentlemen. We've got to get back to private practice of medicine. Medicine that is free of government and insurance company intrusion and protects the sacred bond between the doctor and the patient. Only 3 things, just 3 things, are required to make this a reality. 1, true health savings accounts. 2, true catastrophic insurance. Number 3, all medical expenses are 100% deductible. We've already talked about you have to spend 10% of your adjusted gross income on medical expenses before you can deduct a penny. But if you're a corporation, you can deduct from penny 1, and that's simply wrong. The catastrophic plan and the health saving accounts belong to the patient. Now, pre-existing conditions are no longer an issue. A free enterprise solution already in the works. Concierge physicians. They care for fewer patients, ranging from 100 to 500 patients per doctor per year. Today's average, 3,000 to 4,000 patients per doctor per year. So every time a doctor becomes a concierge doctor and sees only 500 patients, where do those other 3,500 patients go, besides in line? Annual fee, $1,000 to $25,000 per year per patient. Now, that is a very wide range, but my research has shown that the average is $2,500 per year per patient. Another part of the big picture. As a society, we will always be confronted with a certain percentage of the population that simply cannot afford to purchase health insurance. That's just simply a fact of life. But ladies and gentlemen, the American people are a very generous people. We give more money to charity than any other nation on the planet. But as you get a little older, kicked around, beaten up a little bit about life, you learn that the simple solutions are normally the best. Those closest to the problem are best equipped to handle the problem. Doctors and hospitals have always performed pro bono work. For the majority of Americans, let's just keep it simple. One catastrophic plan plus health savings account makes health care affordable for all Americans. Now the patient is in charge. The American people have voted away their freedoms in exchange for the promise of free medical. It is only taking 2 generations from what is commonly called the greatest generation. Now, ladies and gentlemen, we have a lot of problems in this country, a lot of problems. But we've had problems in the past. This is George Washington taking the Continental Army into winter quarters. They had no medicine, they had no shelter, they had no food. But George Washington had a patriot known as Thomas Paine, who wrote what is commonly known as the Sunshine Patriot. These are the times that try men's souls. Will you be a sunshine patriot and only fight in the warmth of summer? Or will you see the cause through in the cold and dampness of winter? Ladies and gentlemen, we can't afford any sunshine patriots. Everyone must stand up and demand that the government give control of our medical back to us. 2 things you can do. Number 1, really drive your elected representatives crazy. Email them, mail them, tweet, Facebook, whatever your mean of communication is, but constantly bombard your representatives saying Obamacare must be repealed. And second, and maybe most important, talk to everyone you know at work, at church, at school, at social functions, even your liberal friends, and point out to them that they're going to lose as many freedoms as you are. Individual control equals individual choice. Remember, ladies and gentlemen, he who pays the piper calls the tune. Now, I've asked you many questions tonight, but there's one thing I'm absolutely sure of. Our founding documents, the Declaration of Independence and the Constitution, define and guarantee our rights. Public Law 111148 does this to our rights. Thank you for your time. Individual control equals individual choice. Talk to everyone you know at work, at church, at school, at social functions, even your liberal friends, and point out to them that they're going to lose as many freedoms as you are.